Hello, I'm Dr. Carlo Carandang, and I'm a psychiatrist with AnxietyBoss.com. Today, I will talk about social anxiety disorder, also known as social phobia. Social anxiety disorder, also known as social phobia, is an anxiety disorder where you have excessive fear of social scrutiny and you avoid social situations. So the audience will benefit from this presentation by learning more about SAD and how they can treat it. So here are some facts about SAD. The lifetime prevalence of SAD in the population is 5%. So in other words, in the general population, 5% of people at any point in their lifetimes will have developed social anxiety disorder. So this is a fairly common disease in the general population where 5% will have developed social anxiety at any point in their lifetimes in the general population. Over 80% of people with social phobia do not receive treatment, and the average age when individuals first seek treatment is 27.2 years. So in other words, the majority of people with social anxiety disorder do not receive treatment, and if they do finally receive treatment, they receive it well into adulthood, into their late 20s. Those at increased risk for developing SAD include being Native American, being young, or having low income. Social anxiety disorder also tends to co-occur with other disorders, such as generalized anxiety disorder, bipolar disorder, avoidant personality disorder, and dependent personality disorder. So now we are going to talk about SAD symptoms. In social anxiety disorder, you have an excessive fear of social or performance situations where embarrassment may occur. So in SAD, you have a fear of social situations. So for instance, you might have a fear of crowded places, such as going to the mall or to the grocery store, as you are fearful that other people are just going to make fun of you or that you may just embarrass yourself. There is a subtype of social anxiety disorder called performance anxiety, where you have a fear of performing in front of people. Performance anxiety is also called stage fright. So when you have stage fright, you have a fear of speaking or performing in front of an audience as you are afraid of embarrassing yourself or that the audience will make fun of you. So with performance anxiety or stage fright, you might have a fear of playing music in front of people or speaking in front of people or singing in front of people. So this is called performance anxiety or stage fright, which is a subtype of social anxiety disorder. Other people with SAD might have a fear of being observed while they're eating or drinking, for instance. So you might have a fear of being observed eating or drinking in front of people as you are afraid that doing that act will embarrass yourself and people will make fun of you while they're watching you. Also, exposure to social or performance situations brings about an anxiety response so that these situations are avoided. So when you have social anxiety disorder, you avoid social situations or performance situations at all costs, as when you are exposed to the social situation or the feared performance situation, what happens is that this brings about an anxiety response where you might actually have a panic attack while you are performing or while you're with other people as you have social anxiety or performance anxiety. So social situations and performance situations are avoided at all costs if you have social anxiety disorder. So how do you diagnose social anxiety disorder? Well, these symptoms of social anxiety or performance anxiety and the avoidance of social or performance situations, they have to interfere with your life and disrupt your functioning. So not only do you have to have the previously mentioned symptoms of social anxiety or performance anxiety, you also have the avoidance of these situations, and it has significant impact on your life where it disrupts your functioning. So what happens is that social anxiety starts to make you homebound. So pretty soon, when you start avoiding social situations, then, or you start avoiding performance situations, what happens is that you start to become homebound. You might you might call in sick from work as you don't want to give your presentation to your coworkers as you have an important project to present. So what happens is that when you have social anxiety or performance anxiety, you start to avoid these social and performance situations to the point where it starts disrupting your life. So maybe you're at risk for being fired as you can't go to work and present your projects, or you might have relationship problems because you're so anxious to go out of your home that you can't connect with your friends and family. So this is what I mean by making a diagnosis of social anxiety disorder, is that it has to have significant impact on your life and functioning. So what is the clinical course of SAD? Well, social anxiety disorder starts at an average age of 15.1 years, and it lasts an average of 16.3 years. So in other words, social anxiety disorder starts in adolescence and it lasts a long time. And most people with social anxiety disorder report performance anxiety. So most people with SAD have stage fright. So how does social anxiety disorder develop? Well, we can look at this negative cycle of social phobia to tell us how social anxiety develops. So let's say you have to give a presentation to your coworkers. So what happens is that if you are prone to social anxiety, then this presentation to coworkers triggers you. So this situation induces thoughts about the event. So you might have thoughts about the presentation that everyone will make fun of me, they will think I'm stupid, I will embarrass myself, and they will not like me. However, these thoughts then induces anxiety, where you might have anxiety, you are fearful, you're self-conscious, and then you have physical sensations of the adrenaline response, such as increased heartbeat, increased breathing, shortness of breath, lump in the throat, butterflies in the stomach. So these are the physical sensations of anxiety that you might develop when you're speaking in front of people, the butterfly in the stomach and the lump in the throat, or the trembling knees and legs. So then these anxiety symptoms then, see, what happens is that these anxiety symptoms then make you want to avoid these social situations, these performance situations. So what happens is you avoid the performance situation and you try to get out of presenting to your coworker. Maybe you'll call in sick, or if you do go, you'll delay it. And then if you do go, and if you do decide to go up there and present to your coworkers, you might avoid eye contact, you might not talk, you might hide, you might actually drink if there's alcohol available, or you might just plan your escape. And when you're giving a presentation, you might even do the unthinkable, whereas you might just become paralyzed where you can't speak or move. And so what happens then is that this avoidance, when you start to avoid these performance or social situations, this then maintains the belief that people are making fun of you, and you never get to find out that if you just go and just relax and focus on the task at hand, that you can give a presentation to your coworkers and your worst fear will not come to fruition. However, if you avoid giving presentations or avoid social situations, you never get to find out that your worst fear never really comes about, that people are making fun of you, when in fact that what they're looking for is a good presentation, and they want to be knowledgeable about what you have to offer in your presentation. So this avoidance then maintains the belief that people are making fun of you, and then this then maintains this negative vicious cycle of social phobia. And then as you see here in the middle, when you have social phobia, you have this extreme self-focus. So you're so focused on yourself that people are going to make fun of you, that you look funny, that maybe you're stupid. So what happens is that as you get into this negative vicious cycle of social phobia, you become too self-focused, when in fact people aren't really looking at you or evaluating you. They are really wanting to look at your content and what you have to deliver, instead of all the traits that you are worried about. So let's talk now about the neurobiology and family history of social anxiety disorder. In social anxiety disorder, there is increased activity in the amygdala. So the amygdala is the fear and anxiety center of the brain. So this is where fear and anxiety is mediated. In social anxiety disorder, there may be a disruption of the brain circuits which connect the prefrontal cortex and the limbic region, which includes the amygdala. So social anxiety disorder runs in families. And so, in other words, you can get social anxiety disorder from your parents, both from genetic factors and from environmental factors. So, in other words, your parents might give it to you as they pass it down to you with their genes. Also, they might model it for you by acting in ways that make you prone to social anxiety disorder. For instance, they may have these negative attributions about social situations that they might think people are making fun of them, or they might embarrass themselves, and then hence they get anxious and then they start avoiding. So once you start observing how they react to social situations, you in turn, as the offspring, might emulate the way they think and avoid social situations that set you up also for social anxiety disorder, which also piggybacks on the genetic factors where you might actually just be prone to it anyways because you biologically, the genes, the social anxiety genes are already passed on to you, and then the way your parents model how they deal with social anxiety might make you even more prone to developing social anxiety disorder. So how do you treat social anxiety disorder? Well, the first line of treatment for social anxiety disorder is cognitive behavioral therapy, also known as CBT. The great thing about CBT is that it lasts longer than pharmacotherapy. So pharmacotherapy is prescription medication treatment for social anxiety disorder. However, CBT is first line. So when you have social anxiety disorder, CBT is the treatment that should be tried first. And if you have a positive effect to CBT, then the effects will last longer than, say, if you chose to do medication treatment. So that's the benefit of psychotherapy, is that it lasts longer than medication treatment. So let's say you do not respond to CBT. So if CBT is not effective for your social anxiety disorder, then your doctor might prescribe you a medication treatment. So prescription drug treatment for social anxiety disorder is last resort treatment. Again, it is for cases where CBT is not effective, or if you have a severe case of SID, then your doctor may go ahead and prescribe you medication treatment. So medications that are effective for SID include selective serotonin reuptake inhibitors, also known as SSRIs, and serotonin norepinephrine reuptake inhibitors, also known as SNRIs. Your doctor may also choose to treat your SID with benzodiazepines. However, benzodiazepines are generally not prescribed for SID. It's not recommended for SID, given that this anxiety disorder has a chronic course, and benzodiazepines have an addictive potential. And if the anxiety is severe, then the benzodiazepines can be prescribed on a short-term basis until the SSRI or SNRI that your doctor is prescribing takes effect a few weeks later. So really, the main role for benzodiazepines and SID would be to prescribe it to take it on a short-term basis until the SSRI or the SNRI that your doctor is prescribing you takes effect a few weeks later. Then, after the SSRI or SNRI becomes effective, then the benzodiazepine can then be tapered and eventually discontinued. See, the issue with SSRIs and SNRIs is that they may initially increase agitation and anxiety. So this might happen in the first week or two of SSRI or SNRI treatment. So to combat this side effect of SSRIs and SNRIs, where it causes increased anxiety and agitation during the first couple of weeks, your doctor may prescribe a benzodiazepine to help calm both your anxiety and your agitation. From the SSRI or SNRI, and then once in about 3 to 6 weeks, once the SSRI or SNRI becomes effective, and then your anxiety calms down, then at that time your doctor can then taper and eventually discontinue your benzodiazepine. The problem with benzodiazepines, if you take it more than a couple of months, is that you start to become dependent on it, and then what happens is you might be taking more and more of it, and pretty soon you become addicted to the benzodiazepine, which is not a good. And then you get a separate problem than the problem that you were originally prescribed the benzodiazepine in the first place. So not only do you, at that point, not only would you have an anxiety disorder, then you now have an substance abuse addiction disorder to benzodiazepines. So again, benzodiazepines are only meant to be prescribed short term and only until the SSRI or SNRI takes effect a few weeks later. Then at that point, the benzodiazepines can be discontinued. So performance anxiety, as I mentioned before, is a subtype of social anxiety disorder. And people that have performance anxiety only have the anxiety when they have to perform in front of the audience. So people with performance anxiety don't necessarily have social anxiety. So people with performance anxiety or people who have stage fright can go to the malls, they could go to public places, to crowded places, because they're not performing in front of them. So their real fear is that when they perform in front of an audience is that their extreme fear is about performing. So it's not about exposing themselves to other people, it's about performing in front of them. And this anxiety only comes about when they're in performance situations. So in these situations, SSRIs or SNRIs or benzodiazepines aren't really prescribed. What's effective for performance anxiety or stage fright during these discrete situations where you have to give a performance is that doctors will often resort to beta blockers like propranolol, which is commonly prescribed for hypertension, but it is also prescribed for people with stage fright. So what happens is that when you are only anxious when you have to give a speech or when you have to perform in front of people, then what your doctor can do is prescribe you propranolol, something like propranolol, 25 to 50 milligrams about 30 minutes to an hour before your scheduled performance, so that once you take the propranolol right before your performance, what happens is that it prevents your heart rate from going up and it prevents you from breathing faster. So what happens is that it prevents the physical symptoms of anxiety from coming up when you are performing in front of people, so that you can go through the performance without being paralyzed or having an anxiety attack during the performance. So again, beta blockers like propranolol are taken on an as-needed basis about 30 minutes to an hour before the scheduled performance. About 25 to 50 milligrams is the usual dosage, and that should last you for an hour or two during the performance, so that it prevents the physical manifestations of the anxiety attack. So there are alternative SAD treatments, and these include exercise, progressive muscle relaxation, diaphragmatic breathing, meditation, yoga, tai chi, massage, martial arts. So these all can help to decrease your overall anxiety levels. However, let me emphasize that these alternative SAD treatments are not meant to be primary treatments for SAD. They're only meant to augment the primary treatments of SAD, which I mentioned before was CBT and or prescription drug treatment for SAD. So these alternative SAD treatments, such as exercise, such as progressive muscle relaxation, yoga, these can be used to augment the primary treatments of SAD, and then these alternative SAD treatments can then lead to an overall decrease of your anxiety levels, but they're not meant to be used as primary treatments. There are also other alternative SAD treatments which include natural supplements. So there are multiple studies that show that several different natural supplements are effective and safe for anxiety disorders such as SAD. And natural supplements generally have fewer side effects and are generally less expensive than prescription medications for anxiety. So in the next few years, you're going to see more and more natural supplements with research studies showing that they're effective for SAD, and people eventually may want to try these natural supplements as they generally have fewer side effects than prescription medications, and they're generally less expensive. Many people like the natural supplements over the prescription drugs just because they're natural and not synthetic or man-made like the prescription drugs that doctors prescribe. Other SAD treatments include self-help. So research has shown that self-help interventions are effective for social anxiety disorder. And self-help interventions are convenient, can be done on your own time, do not require a doctor visit, do not require a therapist visit, and are relatively inexpensive. So in summary, social anxiety disorder is characterized by excessive fear of social scrutiny and avoidance of social situations. However, the good news is that SAD has effective treatments, which includes CBT as first-line treatment and prescription medications as last resort treatments. Alternative treatments include things such as exercise, progressive muscle relaxation, diaphragmatic breathing, natural supplements, and self-help. And they have preliminary evidence that they are both effective and safe for anxiety disorders such as SAD. For more information about social anxiety disorder and other anxiety problems, please visit AnxietyBoss.com. I'm Dr. Carlo Carandang. Thank you for viewing.